Good morning, good afternoon, Jack. It's good to have you here. You have published a chapter in the Handbook of Health Services Evaluations recently, and it's good to talk to you here today. So tell us more about the chapter, please, Jack.
Yeah, thanks, Axel, and hi, everyone. Thanks for joining us. So this chapter provides people perhaps who are less familiar with the method, but also those who have come across it with a bit more information on the standardized patient method. So it has a few different names. You might know it as mystery shopping or the simulated patient method. But essentially, this is a really exciting method we can use to try and view a health service through the lens of a consumer. So it can be quite challenging, as we're aware, to get really reliable patient reported outcome measure or patient experience measures when they're experiencing a health service, because we can't necessarily standardize for everything. So when we use this method, we get to create a standardized script. We get to control some of the variables while it also still happens in the actual environment where the service takes place. So I think it's quite a unique method in the way that we can approach that evaluation. And certainly my native discipline is pharmacy, so it's being used quite a bit in pharmacy, but we are seeing it move to other disciplines quite widely as well. And I think it's a really exciting opportunity for people who might not have come across it before. So hopefully the chapter tells them a bit about how they would approach using the method, some of the ethical considerations, which can be a little bit complicated with this type of work. But yeah, it's really exciting.
Fascinating, really fascinating. So in essence, there's somebody who is going to visit or to be at a health service and reporting back, and they're actually simulating themselves as a patient, as it were.
That's right. So depending on how convincing you can get your actors to be, it can be very convincing. And we hope obviously that they go through undetected, so we can really see the service from start to end, and yeah, get a pretty reliable measure of what happens in actual practice.
Fantastic. And that generates basically individualized experiences,
Exactly.
contrary to sort of like primes or prompts, exactly.
Yeah.
Brilliant, fantastic, excellent. Are you taking this further? This obviously has been a chapter for a handbook, but are you taking this further in your research?
Absolutely. So I've done quite a few studies in this method already, and I'm constantly looking to new ways where even I can challenge myself and extend the use of the method. So I'm actually working with some colleagues internationally at the moment, which is quite exciting. Still in pharmacy, but we're really pushing the boundaries of the extent to where we've used the method before. And I think writing the chapter and rereading the chapter even now has really inspired me to go, what else can I do with it? And I hope that some of the readers get some bright little light bulb moments as well when thinking about how they can use it in their own research.
Fantastic, that's really excellent. And we should say, actually, you published this chapter using the standardized patient method in evaluation health services with your colleagues Wei Wen Chong, Rebecca Moles, and Carl Schneider. So good to talk to you. Thanks so much, Jack.
Thanks very much, Axel.